Welcome to Digication Scholars Conversations. I'm your host, Jeff Yan. In this episode, you will hear part 2 of my conversation with Sharyl Toscano, professor at the School of Nursing at University of Alaska, Anchorage. More links and information about today's conversation can be found on Digication's Twitter, Facebook, and Instagram. Full episodes of Digication Scholars Conversations can be found on YouTube or your favorite podcast app. If it becomes busy work, to be honest, I tell people I'd rather you then don't ask them to reflect, because now they have this really negative association with reflection, and they're like, I don't want to do this. This is boring. Oh, this is just you. I actually heard a student say this, and I was so sad by it. They said when they were advising another student, actually, I overheard this. They said, basically, the professor wants you to stroke their ego.
Oh, my.
And you can see why, though, right? They would think that because they are saying the professor taught you a bunch of stuff this semester. At the end, they are saying, what did you learn? If you say, I learned all the stuff you taught me, hey, that's the right answer.
Wow.
Right?
Yeah.
That's sad, right?
Yeah. That is not exactly what you're looking
That's
for.
when I please stop asking them to reflect, because you are really actually, if anything, you push them further into the hole of that they will never get out of, because if that's how they think about reflection,
right.
It becomes a not only busy work, it actually was for your benefit. It wasn't even for them. It wasn't even busy work just to, all right, we have to get it done. It was more like you just needed some reassurance that you've done a good job.
Yes. Yes, and sometimes I get with the essentials, that's just for accreditation, which it is a great way to show that you've met the standards, but that's not really the point of the assignment. It's just sort of one of the extras, right? Because when you go through accreditation for different, whatever program, you have to show examples of student work. So yes, I tell the students, well, yes, it is a great example of the work that you've done here, but that's not really why we do the assignment. Because we can pull that work together in other ways. The portfolio is just a nice way to do it. But the key point to this assignment is actually that one of the reasons that made me think of doing this is I saw students, particularly more recently, we've kind of passed our golden years in nursing, I think, but going into a different era. But they just go through school, and there wasn't seeing a lot of acknowledgement of what they'd accomplished. They're just like, I just need to get through school. I just need to get through school. And I wasn't really that student. I love school. I'm still in school, right? So I obviously just
you never left.
I love school. And so I wanted to kind of leave them with some appreciation for them, like show them what they've actually accomplished. So this project actually kind of, you have to review everything that you've done across the whole program, and they're doing it right before they graduate. And most students will share at the end, they're like, wow, this, I wasn't really excited about this to begin with, but I really feel like I didn't realize how much I'd actually accomplished, how much I'd actually done here. And so they do that right before.
I love that. I do wish that more people allow students to have more opportunities to do that more frequently and early. But this idea in my mind of not just any student, just any humans, anyone, to get given some time and space to say, here is a body of work or a body of things that you've done. It doesn't have to be work, right? It could be play. It could be other kinds of, experiences and achievements and whatnot. But the ability for someone to have the time and space to just go, here's a body of things that you've done. Some people, think of it as sort of integrated learning, but I think that I love that. But I also think that there is um, a really interesting, almost like neurological model that gets structured around your self-worth and your sense of self. And so to me, every time that, anytime that someone gets a chance to say, hey, let's take a look at your body of work, or you have to present your body of work, maybe not in the like formal presentation, but more like telling a friend, telling a new person that you never know about, doing a podcast. um, that it sort of builds additional like neuron, like connections in your brain that says, that's the kind of person that I am. This is how I do life.
Yeah.
I think that's amazing. I think that's what a gift that you give your students.
Just kind of flip the lens a little bit.
Yeah.
Yeah.
It's I think it's
Yeah.
I think it's wonderful. This is why I wish that people make that a bigger part of life in general. So it's not like, oh, well, now that you're graduating, you look what you've done in this last, 4 years. But I almost feel like, what happened this week,
Yeah.
um,
I feel like when you have adolescents, you could have a review of your so your
right.
parenting successes, right?
Well,
Can get
that's how you keep yourself sane.
yeah.
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 Do can we? Would you mind if we switch the topic for a
Yeah.
moment? I know that you also work with. Um, I mean, there's been a pattern of you working with the native population. Um,
Yeah. We're
Sounds like first in was definitely in both in Hawaii and
yeah.
Alaska, but maybe elsewhere as well. Have you that?
Um, for Indigenous, mostly just Hawaii and
No,
Alaska.
no.
Yeah.
And can you tell us a little bit more about that? What does that mean? What is the work?
Mhm.
What is it like? What did you do?
Yeah. So in um, in Hawaii, I worked with the Hawaiian population, but also American Samoa, Tonga, um, other populations. I was more at the health center there. I was more in the working in the military, which is its own um, culture. So
Mhm.
mostly I worked with students. And one of the things that was really unique in Hawaii that I noticed is no one in Hawaii says, "Why aren't you a doctor?" Which nursing in Hawaii is like, you know, everyone wants their kid to go to nursing. And so much so that sometimes when students weren't successful, they were actually happy because they actually didn't want to be a nurse. So, and I was expecting all this disappointment, when they actually were like, "Oh, thank goodness," because they actually didn't wanna do it. So
That's so
that was a
interesting.
big big
Is that a
difference.
culture? Is it just a general
I
culture, or
think it's something unique about when I was in Hawaii, it was just very much, other places people often say, "Well, why aren't you a doctor?" Or why aren't it's like a but not there. Like, nursing is very respected. And so it was kind of a very unique experience while I was there. Um, but definitely, like, the storytelling that we've been talking about is very integral to both Hawaiian and very much so in the Alaska Native population. And I would say I've worked more closely with the Alaska Native population, like here, because I've been with the hospital since 2012. So, and with working a lot with families, and so when families come in for healthcare, like Anchorage is a hub, and so we get families from a lot of the rural villages that will come to the hub. Whereas on the adult side of the hospital, sometimes you get patients from the hubs, but there's more access to adult care at the other hubs that aren't Anchorage. And so, you know, when you think about, a lot of things we've been talking about as far as the nonviolent communication, it's a very non-confrontational culture, and so often, and it's not hierarchical. Like the hospital is owned by the people, so the patient is the owner. it's a customer owner is the word that is
Hmm.
used. And so it really changes the dynamic in the hospital because, somebody who's, doing housekeeping or, is at their desk or, even the provider, they all may own the hospital, they're owner. And so all of these sort of levels of hierarchy for me, I've noticed is really nice because that's removed. And so I feel like
So it wasn't
communication,
like this is the big boss, and
right?
then here are the
Yeah,
second and the third big boss. This and right.
right. I
Okay.
don't feel that as much there. And and so but the stories, like, often I would bring students over to the hospital too sometimes, and I would disappear, like, literally for 40 minutes. They'll say, "Well, where were you?" And I was like, "Well, I just got the greatest story." If you go into a room and you start talking to an elder, and
Mm.
you just hear the most amazing stories 'cause, the culture there is amazing storytelling. Um, once it was about the last time that this person was in the hospital was actually when she was a young girl, and it was during the big earthquake,
Yeah.
and so you it's a different way of doing health assessment because before I went into the room, the patient was, very anxious and, uh, the nurses were having trouble, um, providing care, and then I sat down and talked with her, and I figured out where the anxiety was coming from. She was sort of thinking back to her last time. It's a
Mm.
different hospital. They actually built a new hospital, but for her, all these things had happened the last time she'd been to they call it the native hospital. That's their name for it. But
Yeah.
um and so I don't know, I don't know if that answers your question, but it's a very different way of it's more of a narrative medicine approach that I would take with my patients at the hospital where I try to figure out the story as opposed to like coming in with a, checklist of what are your symptoms or you're not going to get very far if you approach uh, health in that way. Um, or I've seen people approach education where they have this list of things they're going to go through to educate, as
Yeah.
opposed to sort of integrating it into your daily care. Um, I don't, yeah, it's been a gift to work with the cult. Um, it's one of the, it's probably the best hospital I've worked for, I think, as far as just the population and I don't know. It's just been a real gift to work there.
I think that is so amazing. I can s- I can see why you are wired the way that you are and what draw you to all of this work. Um, do, do you think that there is something? What are some of your observations in terms of you talk about storytelling, right? It's a big part of their culture. It's a big part of your ability to tell these amazing stories and have gathered so many stories. By the way, we all have lots of lived experience, but we don't, at least in sort of the sort of mainland, Western culture, we don't think of these as stories. We don't collect them. We just sort of it happened and that was it. Maybe it's more like you know, you tell people at a bar, like it, but 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 there are many cultures where stories are treasured. You collect them like you are, you know, like people collect certificates, you know. And I don't want to say it's not the vain way of saying, "Hey, I just have a lot of certificate." It's just like you really value them; they are useful. It can come in handy at some point in your life. I think there is something so beautiful about that we are almost kind of, for some reason, have missed the boat on. Like I see a lot of students, for example, going to school, and I'm talking even K-12 schools, right? Um, where you had talked about, NVC being used in certain models, right? But in the more mainstream sort of traditional school model, I see students, including students coming, I'm sure coming to your classes where they go, I have an assignment. Tell me what I need to do. Tell me what the expectation. How do I get an A on this?
Right.
I'll do it. Not only do I what I do it, I'll do a good job at following all of those things. But the second that I submit it to you or hit the submit button, whatever, whether it's a paper or technology, it doesn't matter. The second I do that, I'm done. I
Right.
don't even think about it ever again. It's not part of the story that I keep. In
Mhm.
fact, I get to forget it.
Right.
Now I've done it, so you grade it, and then it will exist as a some kind of percentage in my grades, and that's it.
Mhm.
I think there's something there that makes me feel really sad about because that narrative, that the accumulative sort of narrative, that body of work is so incredibly powerful and useful. Where when I think about these very fragmented pieces where the person does it in almost like a very short memory game, you just kind of do it and then you just don't think about it anymore.
Mhm.
It's almost like to me, it feels like a waste of time. It feels like that time just got lost because you didn't get much out of it.
Yeah. It's sort of the what's on the test phenomena. There's
Yeah,
sort you
right.
do
You
this.
study for a test.
Yeah.
At the end of the test, you just kind of like, you just really go, I did well on the test, but you really just, even if someone asks you that same thing again in like three
Yeah.
days, you'd be like, I have no idea.
Yeah.
I knew it 3 days ago, by the way.
I know I've had these as an educator, I've had these, classes where I've been like, I feel like I'm on fire. I have these great stories, pulling out
Yeah,
all these concepts and
yeah.
ideas. And, the students are engaged. And then always at the end of the class, somebody will say, so what of that is on the test? I'm just like, oh my gosh.
Yeah.
You know, yet it always kills me.
What's on the test?
Yeah.
Um, what do you think are some of the, it seems like that you're very in tune with what students are doing these. I mean, you talked earlier about sort of going from a, nursing has changed. You're talking about team nursing and things that you weren't, that you said, that's not how I was trained or how I practiced before. Um, and of course, that probably means that, you also have to now change in how you
Mhm.
teach your students and new skills, new ways of teaching and learning. And then you had talked about students, sort of, need to figure out how to take care of themselves and dealing with burnouts and stuff like that. If, it's sort of like a very like, sky view level looking at nursing education right now. What are some of the, what you think some of the big, um, either where some of the hurdles, but also some opportunities are in advancing, the field and making, I love your vision of, hey, they shouldn't even have to be resilient because it implies that something's wrong. They have to just survive it. But how do they naturally just kind of thrive it because it's just an enjoyable thing? But by the way, I think that it's probably, correct me if I'm wrong, but I think most people want to go into nursing because they can get joy out of helping other people.
That's
And
a common, yeah.
right,
Or they've had some life experience that has brought
right.
them close and they've recognized, oh,
How
they want to be
important
that.
that would be to bring it to another person,
Yeah.
you know?
Yeah.
So these are such worthy, like root level, like directions. So what happened and how do we, like, what are some of the opportunities now that you see? Maybe team nursing is part of the thing. I don't know. I mean, I don't know enough about it. Can you tell us more?
Well, for that, I'm hoping I think the team structure happened during, the pandemic. Like it was a necessity because you just didn't have the people. But, my personal philosophy is that that's not the model that's actually
Mm.
going to be the best moving forward. But sometimes you have to drop back to these survival modes where
Uh,
the emphasis might be safety, efficiency, you and you. you lose some of those other aspirations during times of, extreme, um, circumstances. But and sometimes I think on the admin side or the hospital side, they see the cost savings of those now, right?
Okay.
And so
Well, because you've cut some corners, so of
right.
course there's some
Yes,
savings,
many.
but you have to realize that the corners you cut, someone's paying for it. There's a
Right.
different cost somewhere.
And
Right.
so there's always this, there's that side that they want, more nurses, cheaper nurses, eh, and there's been less unionization of nurses compared to the past where, that those sort of things are kept in balance. So I think right now there's, and I'm not in the sort of nurse management arena, but there's definitely this sort of conflict between, staffing ratio. There's been legislation trying to regulate staffing ratios of nursing, and there's always been lots of lobbyists that come out. In many states, it hasn't been successful convincing, the consumer that this is going to somehow make their care worse. Because I don't think they understand um, that when you have a nurse who has too many patients, that's actually what is driving your care, not necessarily that they're sending in these arguments and about this is decreasing their access because you know the provider will only be able to take care of this number of patients. But in healthcare, it's hidden. Quality is hidden, right? You don't know. Your surgeon might you know be nice to chat with, but you really don't know the quality of surgeon that he or she is, right? In other areas, yeah, quality is not as hidden. If you buy a dress and it falls apart in a week, like that was not very good. If you have poor quality healthcare, you might not know ever, or that might
Mhm.
not you might not realize it for years.
Until it's too late,
Um,
right. Mhm.
yeah. And so anyway, kind of got off on tangent, but there is this sort of things happen during pandemic time that were
Mhm.
emergency. And there was legislation and things that allowed for that to happen, like changing some of the rules. And now as we're starting to get back into those rules are we don't need
Yeah.
those rules anymore. I think sometimes they're looking at the cost different, but I think that students do have to be prepared for what they might see. Are they going to be asked to kind of function in a more team-like scenario? And that's more where you're task oriented. So instead of having the care for one patient, which is somewhat of a safety net because you have somebody who has eyes on all of, what's
Mm,
physical
I
therapy doing,
see.
what's speech doing, what are the docs doing, what, the
Mhm.
nurses
Yep.
usually has eyes on all of that. So they're divide more in tasks. So this person's doing medications, this person's doing procedures. We're delegating all this to CNA or LPN. Um, it's more like the system when I very like 1994. It was myself, a new grad. I would have 10 patients. The LPN would have 10 patients. And really at the time, the LPN, although she was really in charge of me, if to be honest, because she had, she'd been in nursing for 40 years, and you know, but as far as the licensing agreements and things that they could do, you were sort of not their supervisor, but you were sort of the lead of the team. So there was this kind of strange dynamic there when um, they were really extremely. So I'm not dismissing the value of LPNs because I learned a ton. And I wouldn't be the nurse I am today without the LPNs that I worked with. But back then, the acuity was very different. We had patients that don't even stay overnight anymore. So you would basically, out of those 10 patients, one or two would be sick, and the rest were sort of your standard post op patients that nowadays go home. Like you don't even
Mm,
see them.
right.
And so when implementing some of this team based, that's when it becomes really stressful because you have extremely sick patients. Um, and it's very stressful when you start being responsible for more than, say, I think in peds anyway, it's like four, and the NICU we have three. Um, but on some of the adult floors, they can see six, eight, maybe more patients. So if you think about that in an hour, they're supposed to touch base with that patient every hour. So if you have 6 to 8 in an
You're
hour,
just constantly running around. Yeah,
yeah.
you can't. Yeah.
Yeah, so it's really it's nurses are costly, I suppose, but it also costs more to close the unit. So there's all
Mhm.
these kind of
More,
cost
yeah,
drivers there. Um, but I think one of the bigger things is to give new nurses a voice of when it's unsafe. And so
yeah,
how do they express that? And um, what are the rules and regulations around that? Like, you can't abandon the patient. If you show up and you get an assignment that's unsafe, you can't leave because that's abandoning a patient. And many of the boards of nursing, you can get disciplined for that. So it's how do they document that unsafe assignment without having consequences to their license? And how do they make change within the system they're in, um, sort of in a productive way?
yeah.
So kind of focusing on some of those tools. Um,
By the way, coming sort of full circle, I feel like that those tools that we're talking about are the kind of reflective storytelling and conversational, sort of tools that you're playing with, with your students. Nonviolent way of communicating those things, ways to be able to do things without judgment and not blaming in any specific people or person, and just being able to calmly go in and
exact,
look
yeah,
at a situation.
exactly.
Yeah.
And I can see, like, as soon as you flip it, when you're not attacking the person
Mhm.
and you're saying, I'm feeling really scared. If you start off with
Yeah.
that, the manager is like, what? Instead of you did this, this, and this. It's
Yeah.
like
Why did you put me into this position?
I know, and
You.
I've said that I'm
Right.
scared, and they're like,
Yeah.
oh, okay, and their ears open, right?
Right.
When
Right.
it does require that they also share a little bit of their vulnerability, because
Mhm.
when you're using any of the storytelling or NBC, you are a little bit vulnerable. So
Yeah.
that takes a little practice to be open to that when, sometimes your first instinct is to just,
Mhm.
keep quiet and
Well, that
yeah,
practice is in fact what's so healthy, though. Like in the case of them being able to do it with you in the education environment in a class where they are hopefully safe from themselves, from you, from their colleagues, so that they can practice that, because I think it is a skill, isn't it? It's a skill
yeah,
that you practice enough that you'd then be able to use that in a situation. And by the way, this is kind of amazing to me, because people talk about reflection in this as this very nebulous, abstract concept that it's like if you've done it or done it well or experienced it, you know it and you feel great about it and you learn from it, and that's kind of it. But if you haven't, I have no way to tell you what it is. Um, it's like telling someone about riding a bicycle or swimming or love, like, yeah, I don't know how to describe it. But you actually just kind of created a very solid um, example of how that reflective skill can really be used in a very productive, practical way. In how do you confront situations, well, in this case, even with the actual skill of doing the confrontation itself, but just mentally, first of all, how do you confront a situation when you're like, I'm scared, I'm in danger, I'm in, this is not fair or this is not right, because it may not be in nursing, right? Um, I I really feel like that there's a lot that, well, I certainly have learned a lot, but I think that a lot of our listeners will learn from this, in how, for me, a very advanced set of topics that you've discovered, sort of one after the other, that I really feel like that whether I'm teaching in a STEM program or in a, you know, in the arts or humanities, I could borrow a lot of what you are saying, and use it very positively for sort of general education and pedagogy. I really do. I think that it's, you've lent us a really beautiful insight to this. I especially love this thing that at the end that you said. I don't even think that you thought you did it on like sort of like deliberately, but I was like, wait, hold on a minute. So all of those communication and processing skills that you have students do, which is in, the way that you teach them how to reflect, could be used, in fact, to communicate with someone to solve a problem. So it's no longer this abstract, just you reflect and you feel great, and then you can now go home and get a better sleep. It's more like, no, literally, I'm in trouble. I needed to go in and talk to someone about something, and I'm borrowing some of the skills to go in and do that communication. I think it's lovely.
That's my hope that they'll use it.
Well, Sharyl, I feel like that there's much more that we can learn from you, and I hope that we get to do that again soon. But today, I think this is a good first chapter of Sharyl and her wisdom from nursing. But really, like, I think there's so much to unpack. Your experience with, Native Alaskan, especially now, all of these kind of, I hadn't thought about a culture that is, based on, that is has so much, place so much value on narrative, for example. That just opens up so many possibilities in my mind, like right away. So we got to talk more, but for today, we will pause for now. Hopefully we can talk more again soon. And Sharyl, I can't thank you enough. You've this is incredible for me as a learning experience. I appreciate you so much.
Thanks, Steph. It's been fun. Thanks.
All right. Take care.
Bye.
Coming up next, we'll be chatting with Kyle Hewson, Vice Chair and Clinical Associate Professor in the Doctorate in Physical Therapy program at Stony Brook University. Here's a quick preview.
So the idea that they put up a PowerPoint that they did in their first year with 2 or 3 people, even just to show them how advanced they've become in some of their presentations by the 3rd year. They have this and that, and their references are awesome, and they're able to pull in a video or something. So and they feel so much more comfortable because they say, I was such a nervous person that first time I had to get up in front of 80 students, so it's kind of neat, that.
See you next time.